Welcome back. While much of Canada has increased restrictions and battles Omicron cases, it is a bit of a different story south of the border. The U.S. Centers for Disease Control has issued a level 4 advisory that reads, "Do not travel to Canada due to COVID-19. Here to give us some perspective on the differences to the approaches to COVID in Canada and the U.S. is the head of the Department of Medicine at Queen's University, Dr. Stephen Archer. Good morning and thanks for joining us.
Morning, Erin. Thanks for having me.
So you have spent half of your career in the U.S. and also obviously working here in Canada. How is Canada doing with COVID versus the United States, in your opinion?
Well, actually, I don't take any pleasure in anyone else's suffering, but we're doing relatively well. So if you look at in Canada, about 6% of Canadians have been infected with COVID over the total pandemic versus 18% in the United States. If you look at the chances of dying if you get COVID, it's higher in the States at about 1.4% versus 1.3% in Canada. So similar, but a little better here. And if you look at the percentage of the population vaccinated, we're about 78% vaccinated and they're about 63% vaccinated. So 15% higher. So our system has lots of problems, but I think if you look at hard numbers, we're doing pretty well.
Okay, so why then is the U.S., why have they seemed to open some of their capacities and Canada is still closed with restrictions?
That's all about attitude and very little about science. So even if you look at the United States as a heterogeneous country, different states are different. So for example, New York and California are kind of like Canada, and Texas and Florida are kind of not like Canada. And if you look at the public health policies there between those states, they're very different. New York and California are similar to us, and Texas and Florida are very different. So this is about how you perceive risk and how you value the public health of your people. So for better or worse, in Canada, we probably put a higher weighting on public health and government weighing in on that. And in the States, it's much more personal autonomy and choice. But the reality of how much Omicron is floating around in the communities is not different. In fact, it's higher there than it is here.
And what do you think about the CDC advising people from the States not to come to Canada because of COVID and just everything you're saying? Is that a fair advisory to have if we overall are doing better than the States?
No, it doesn't make any sense. I would view it as political. Yes, we're a high prevalence area, but so are they. And they've largely stopped testing, and to some extent, so have we. So it's sort of, I think it's a bit rich and doesn't make sense. And I have children in the States, and I wouldn't hesitate to advise them to come and see their mom and dad.
That's interesting because it is such a struggle when you have families divided as well. They really feel that pain when things like travel advisories come into effect. And what does Canada need to do to help with the surge in hospitalizations overall?
Well, we have to make some promises to never do things we've done before in the past, never to do those again. So, for example, we need a proper seniors care system because you may not know this, but 10 to 20% of all hospital beds in Canada are tied up with people called alternate level of care people. These are people waiting for nursing homes and seniors residents. They don't belong in hospitals. So seniors care is important. The second thing is we need to not buy into the lie that we don't need acute care hospital beds. That's something the Canadian government has often promoted, but we always run at 90 to 95% of capacity even before the pandemic. So we have no surge capacity. So second is fund hospital beds at a higher level, probably 10% more. And then the third is train more doctors and nurses, because again, it's seen as almost disloyal to the Canadian system to point out there aren't enough doctors and nurses. But even before pandemic times, there weren't, and now we really see it. So those are the suggestions I would make.
What is your view on COVID-19 and the reopening of schools and moving from remote learning back into the classroom?
I applaud it. I think it's the right decision, and I understand the concern the government had, and I understand the concern that parents have about their children being safe. But I think it's a misunderstanding of the epidemiology of this disease. So children, yes, they can get infected and occasionally they can get severe infections, but they're safer in school than they are in the community. Schools are well regulated. We've invested a lot in trying to make the schools safe, and the schools have not been major sources of outbreaks throughout the pandemic. And children, by and large, are relatively protected from this virus just by their age, and then they're eligible for vaccination. So if you really are worried about your children, the rational thing to do is let them go to school and make sure they're vaccinated, The vaccines reduce your risk of getting hospitalized by 6-fold and your risk of being hospitalized in an ICU by 15-fold. So they're amazingly good at protecting against Omicron.
Thank you so much for joining us on this show today and sharing your great perspective on the COVID-19 situation.
Great talking to you, Aaron. Have a good day.
Thanks, you too.
Bye.